Good afternoon, today's May 20th, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is that colleges are going to look really different during the fall, and many universities in the US are deciding to whether or not to reopen their campuses. On Monday, Notre Dame became the first major university to say it would resume in-person classes for the fall semester, while other colleges, including the California State University system, said last week that it would not reopen at all in the fall and that most classes will be held online. So I think it's just the entire idea is extremely complex, including many varieties such as having social distancing during classes, to start early on August to finish by Thanksgiving with no break. And I think I'm just surprised by the complexity, because I was just thinking it was just reopen or not, but it turned out to be like with all these different scenarios and different permutations that they came up with, the colleges, and I think this is extremely good to have all these different ideas to talk about. And personally, I believe that how colleges are going to look is mostly going to be how the school system is going to look like. And so for me, my school district was sending out surveys as to whether or not we should reopen, and personally I think that we should, because we do learn more in person, and online we're not learning as much information as we could have if we were in person. And also colleges, it would be a shame to lose the freedom of college, but I guess it is a sacrifice we have to make during the coronavirus. So the second thing that I'd like to talk about is about the threat of natural disasters. And in India and Bangladesh, there was the cyclone Amphan that made landfall today, and which has driven 3 million people into emergency shelters in India and Bangladesh, some which have recommissioned in recent weeks as coronavirus quarantine areas, and some of the shelters have been filled to only half capacity in an attempt to maintain social distancing. But I feel like there's still the worry that the outbreaks could be started there. And another threat in the US is the 2 dams that have collapsed, and now Michigan currently is grappling with severe flooding. And 2 dams were breached by the rain-swollen waters, now forcing the evacuation of thousands of residents at a moment many had been wary of leaving their homes amid the pandemic. So I think at this point, I would suggest people to evacuate, find shelter, but also be mindful and practice social distancing and try to wear masks if that's not possible amid all the water. But I think these flooding are also going to one of the toxic cleanups, and there's gonna be, and the president has also given aid to Michigan, so I think this is an extremely good idea. The third thing that I'd like to talk about is that after the virus, office workers may be faced with unexpected health problems. So the office buildings were not designed to be left alone for months, and there could be illnesses that are not the virus, which office workers have to worry about. For example, the plumbing in these buildings, the water may have gone stagnant in the pipes or even in individual taps and toilets. And as a result, bacteria that build up may cause health problems. And the biggest worry here is Legionnaires pneumophila. So I've actually learned about this disease, the bacteria which causes Legionnaires disease, which is a respiratory condition, and this disease is very serious. It leads to a death in about 1 in 10 cases, according to the CDC, and 52,000 Americans suffer from the disease each year. So, I just wanted to get some of it does affect people with compromised immune systems, and COVID patients and survivors could be more vulnerable. So I think, and it spreads extremely easily. Just water droplets into the air from taps can spread the disease. So, I think, the facility staffs can flush out the old water and bring in a fresh and new supply, or they can send a high-dose infectant through the building to raise temperatures to kill the microbes. But I just want to say that this is an interesting but unexpected health risk that is very dangerous. That's it. Thank you for listening, and I hope you have a good day.